There were 60 students here yesterday from Silva Heart Magnet. They worked ahead of time cutting all of these out. They put every one of them up yesterday morning. All of those at Silva Magnet are students that are hoping to go into some medical field. We asked two different groups, one of 40 and one of 20, to hold up their hands on how many of them had been affected by breast cancer in their families. Almost a third of each group.
Good morning, welcome.
Real men wear pink. That's the way we do it.
Please welcome Baron White and Heather Guillen White.
Hello, I'm Baron White.
And I'm Heather White Guillen.
And we would like to welcome you to Taking Breast Cancer to Heart.
And thank you for contributing to the health and care of breast cancer patients in need right here at home.
And what a wonderful honor it is to be here amongst those individuals who have gone through cancer, and unfortunately those of us who will probably go through cancer because it is that type of disease. But guess what? This is a beginning, and we're here to start helping and loving and caring for one another.
And now we want to share with you the amazing changes that are occurring in breast cancer care in our community and some of our survivor stories.
I knew I had the lump in my breast, but I waited about 8 months before going to the doctor, and it was confirmed that I had stage 4 breast cancer.
Due to the work of Dr. Zena Nali and her team, University Breast Care Center is now a nationally accredited breast care program, the first and only one in El Paso.
Would make it very easy for patients, any patient, regardless of insurance or resources, to have access to the best quality care for breast diseases and breast cancer.
Se va deshaciendo de todo lo que tiene, poquito a poquito, para juntar ese dinero. Mi esposo ha tenido que vender un carro y ahorita todavía tiene a la venta su motocicleta.
My husband has a lot of health issues. We've been married 41 years and I've been his chief caregiver for 26 of those years. My first thought was, oh my God, I've got to get this taken care of. Who's going to take care of him? I'm not ready to check out. I've got plans. I've got things to do.
Pink isn't for girls. Pink is for warriors. A lot of us out there aren't warriors, and we don't think we're warriors, and sometimes we get discouraged because we're dealing with this type of a thing. But with just the support and the people that rally around us on a daily basis, we're able to feel like we're warriors, like we're generals in an army.
We asked Dr. Nali and her team, we kind of had a question, how many survivors, if we could stop the clock, how many survivors are there in El Paso? And so they looked at 2011 census data and incidence and frequency of breast cancer in women over the age of 20 when breast diagnoses first start coming in. And the estimate they came up with was 7,680. That is 1 in every 37 women over the age of 20. And that hit us a little differently. That's why there's 7,680 butterflies on the backdrop behind me here. Every butterfly you see represents a real breast cancer survivor, standing next to you in the grocery store, passing you on the freeway, dropping our kids at school, sitting next to you in church. Real people, real mothers, real grandmothers, sisters, daughters. But the point is, they're survivors. And that's what we're working for here, more survivors. And that's what you've helped us with today. That's what you've become part of. Butterfly is a powerful symbol of metamorphosis and change, and we hope that this image symbolizes the strength and courage of survivors and their families to soar above the obstacles of breast cancer. If you're a patient with breast cancer, you walk through the door of UBCC and you see a Texas Tech physician. You see a surgeon or a medical oncologist. Diagnostic imaging is provided by UMC. Surgery is performed by a Texas Tech surgeon in UMC surgical suites with UMC nurses and caregivers around you. And you receive infusion at UMC. So it takes all of us. Please welcome Jasmine De La Fuente. She was diagnosed in February of 2015. She only needs one more chemo and radiation treatment. She was going to nursing school, but she had to quit school during treatment. Donna Hazel. Donna was diagnosed with breast cancer in 2012. She was a UMC nurse for 24 years, and now she's a neonatal intensive care unit nurse at El Paso Children's Hospital. Warrior Jennifer DeGraff was diagnosed in January of 2013. She gets chemo every 3 weeks and radiation daily, and through it all, she continues to work as the assistant principal at Urban High School. Maria was diagnosed in October 2012, and she's going to conclude treatment in just the next 6 weeks. Maria loves her work at UTEC College of Business and has found a blessing in the love of family and friends during the journey. Please welcome Thelma Mae Burtley, walking with her son, George. Jordan. Right? Okay, Jordan. Thelma was first diagnosed in 2009. She is now battling lung and brain cancer as well. She was director of Victory Warriors and after-school program at Victory Chapel Ministries, and she shows great courage by being here with us today. Anyone who has a family that's been affected by breast cancer, would you please stand up real quickly? We need to move around a little bit anyway. Just stand up for a moment if you have a family, any member of your family has been affected by breast cancer. You don't have to look far to find someone who's been affected by breast cancer. Here, we are going to ask you to look into your hearts one more time. You have some envelopes on your table, extra love and clothes. And to give you a little help in doing that, we've asked Siobhan to give you a song.
Must have been colder in my shadow to never have something like